So again, the notion behind all these is helping employees today save money, reduce their out-of-pocket expenses. The last program, and the one that tends to appeal the most to employees, is this notion of telemedicine, which is growing today as employees are faced with higher out-of-pocket expenses and these deductibles. And again, the nice thing about this program and all of these benefits is can't be used in conjunction with your insurance. So this would allow me or an employee or my spouse to access a doctor by telephone. They guarantee a call back within 3 hours. I'm calling into a network of doctors, U.S. board certified physicians and U.S. residents. The notion of telemedicine came up with the military years ago. Not surprisingly, many of the doctors in this network were former military doctors, or today are professors, and even some of the doctors today are some of the same doctors that are looking at the cost of running a business today and looking at this as a very viable means of running their business. So these are U.S. physicians that are able to now treat patients via the phone for acute care, things like maybe a sore throat, maybe an ear infection, maybe an upset stomach. Where what's unique about this program and the provider here is ConsultADoc. They are the one provider out there that can actually provide and prescribe antibiotics. So if I had the need to go down to my doctor's down in Westport, it might take me 2 to 3 days to get in there because I starting to get a sore throat and maybe have a chest infection. I know I need a Z-Pak. So I would be able to use this service, guaranteed a call back within 3 hours. They would prescribe me my medication, ask me where I want to fill my prescription, and I would literally be able to get that prescription in a matter of hours. So as the employer, what that does for you certainly is it's going to help reduce the amount of time that maybe somebody's out of work. It's going to help with productivity. Certainly it's going to help that employee that in their deductible maybe has a $100 out-of-pocket expense. It's estimated that as many as 70% of all doctor visits are unnecessary. Even worse, somebody that doesn't have a primary doctor today because there's no need for a gatekeeper anymore, and they go straight to the emergency room because their child is sick, and now there's as much as on average a $1,200 bill attached to that, and maybe they're using your HRA dollars that don't need to be paid out unnecessarily, where that person's in their deductible. Both you as the employer and the employee save, and the employee accesses the care that they need that much more quickly. The way that product works and the way that service is used is the first time an employee goes out and uses it, they go out online, they fill out a health questionnaire just as they would if they went to a doctor for the first time, and they provide as much history about their medical history and prescriptions that they've been on and so on and so forth. So when the doctor calls you back, they are able to do a full consult. The average telephone consult is 22 minutes. So think about, when's the last time you sat with your doctor for 22 minutes? It really doesn't happen. So they're taking the time to address the symptoms, to make sure that they're prescribing a medication that's appropriate. Certainly, they're not going to overextend themselves. If there's a need to see immediate, or seek immediate care, they're going to send you to the ER. But the basis for this is to help give access to care that's quick and going to allow you maybe to avoid unnecessary doctor visits. I guess there's a lot of information that goes with this, and we stress education and making sure the employees understand it so they can utilize it and take advantage of it and reduce the costs that they're going out of pocket for, and certainly reduce your cost as a consequence. So what we're doing, and new benefits in Walmart, they are only allowing us to roll this out through worksite education and one-on-ones. Do you see how any of this might be of value to any of the employees here based on some of the things that you know about your medical plan and your benefits? So Chris, I'm glad you asked how to begin to implement the program. The Walmart card and the new benefits card, as I mentioned, there's no cost associated with that. There's still an education process associated with making sure that people understand how to use it. So we come in, there's an enrollment form with each one of them. Okay, on the Walmart side, they fill out this enrollment form. They bring it in to the Walmart that they most often go to, and we also give them a card. The card is needed to really be held on to in the case that they go to another Walmart down the road. But the enrollment form will put them in the system at that particular Walmart. Alongside of that, as a backup and a check, Walmart in their system down in Bentonville, Arkansas, needs an eligibility file, so they cross-reference the enrollment form against the eligibility file. So as long as we can get an eligibility file from you up front with just basic information, first name, last name, address, date of birth, telephone number, that'll allow us to get that into Walmart's system so people can take advantage of the free prescription card. So certainly everybody's going to want to be able to understand that and utilize that. The second component, we actually, the platform is built on the laptop where we're able to explain each of the benefits. Not unlike what we have done in years past, where we come in and do an informational presentation the first day, answer questions. People tend to capture the most information when they get to hear other people ask questions that maybe they don't think of. And then we will come back, as we've done in the past, and sit with each employee one at a time. Even if they're only getting the free prescription card, we have to make sure they understand they got to bring that enrollment form in. As far as the buy-up option, so to speak, with the Consult-A-Doc and all the different discounts, it's payroll deducted. If I'm choosing to have Consult-A-Doc with that, it's $2.75 a week. If I choose not to have Consult-A-Doc with that, it's $2.30 a week. They have a one-time admin or fulfillment charge of $3.95, so the first deduction will be slightly higher, but then it'll be just like our programs. It's a list bill. It's not the employer's money. They're billing in arrears just as we do. And the programs tend to be very affordable at $230 to $275 a week.
Now, what about my employees that just don't go to Walmart, won't go to Walmart, but still see value in this? You'd mentioned there was another option besides that.
Yeah, so the new benefits card, we'll actually be able to enroll them in that with the same eligibility file. So that'll get sent over to new benefits, and they'll issue the cards for each of the employees based on that. And that's, again, part of the, and it's a good question because it's part of the education process, so people know when they use that card.
It'll be clear that they don't have to go to Walmart to get the discounts.
Right.
They'll get the biggest discounts.
You probably have a number of employees that go to CVS or Walgreens. Mm-hmm. So yeah, that's where they would use that other discount card. And as I showed you in the presentation, the discounts still are pretty significant. It's not the guaranteed lowest price because that's what Walmart is doing to everybody else out there. But it's still a significant discount, especially for those people that are in their deductible or are using a medication today like a Nexium. If they're, with Oxford, Nexium is not covered. So if they're out of pocket.
If they get a prescription that's $100, now they have a discount, it's costing them $60. That's $60 that they're paying. Will that go towards their deductible?
No, and that's another, I'm glad you brought that up. That's part of the education process because the employee is going to have to understand that. And we actually have an acknowledgement form that we have them initial and sign, saying that that's been explained to them. They understand that, so they understand the trade-off is I'm getting this discount. And for your healthy employees that may never hit that deductible, they might not be concerned with it. You might have other people on the other end of that know that they're going to use their deductible up, and they might have a different choice to make.
Okay.
So
pre-tax, after-tax deductions?
In this case, because it's non-insurance, it's after tax.
Okay.
Yeah.